Everybody experiences their caregiver and cancer journey differently, but there are some common issues that caregivers report to struggle with and some challenges that they're faced with. One of those is isolation. I think oftentimes the focus of care is really on the patient, and so everyone's kind of rallying around the person with cancer, and medical teams are really focused on treating the cancer and the person who is sick. And as a caregiver, you also have your own needs, and so it can feel a little bit isolating in that role. Oftentimes, too, caregivers are the ones who are giving up their social life or things that they used to do to stay connected to other people, which can further feel very isolating. Difficulty asking for or accepting help. I oftentimes hear caregivers say that, they feel it's their responsibility, and they feel guilty if they are asking someone else to do a job that they feel responsible for. And so that can further create some isolation and some problems. Role changes is a big one. When a family or a couple, when somebody is faced with serious illness like cancer, oftentimes that person is too sick to do the things that they're used to doing. So there's a lot of role changes. Maybe the person who is sick was the one who took care of the finances and no longer is at a point where they feel well enough to do that. Well, somebody takes over that role, and oftentimes the caregiver is the one taking on all of the additional roles and shifts. We talked a little bit about neglecting personal needs. That's a pretty big one. I oftentimes see caregivers who are so focused on caring for the person who is sick that they forget. They either forget or they just don't make it a priority to take care of themselves. That, the crisis is sort of the person who is ill, and that's the major focus. Health concerns, family challenges, and of course, stress is a big one. With all of these things that we're talking about, it can really impact the stress level. So, common caregiver needs, and talking about the issues that oftentimes caregivers encounter. There's also some needs that caregivers are reporting to need more information or need more assistance. One of that is information about cancer, medications, and treatments. It's very overwhelming to be faced with a diagnosis like cancer. And if you're not in a healthcare background, it's like learning a new language. And even if you are in healthcare, if you're not specifically in oncology, it's very daunting to, read what's being told to you and read the treatment options and all the information that's out there. So it can be a lot for someone to take on. Help with financial issues and insurance coverage. I think this is one of the major stressors is dealing with insurance is never easy. But when it comes to cancer and all of the treatments that you may need and the medical appointments and specialists that you're seeing, it can be very overwhelming to know what's covered and what's not. And, I think this is an area that caregivers really report that a need for more assistance managing and understanding some of those problems. Help communicating with medical professionals, some legal advice, learning care tasks, and addressing transitions in care at different times throughout treatment or the cancer journey. There may be transitions, maybe rehab is needed. Maybe a treatment isn't working and you're faced with making a decision about what to do next. These are all different transitions, and it's hard to navigate that as a caregiver and as a family together. Help with addressing end-of-life issues. advice moving a loved one onto a facility, and also kind of help dealing with the family. So because cancer is a family disease, it's impacting everybody in your life. So as a caregiver, you may be more attuned to that, but it's also likely having an impact on the children or the grandchildren or the siblings that exist as well.